السلام عليكم ورحمة الله. بسم الله الرحمن الرحيم، والصلاة والسلام على خير الأنام سيدنا محمد وعلى آله وصحبه وسلم. إن شاء الله, today we'll discuss the therapeutic guide to hypertension management, especially we will speak about the hypertensive crisis. And we mean by hypertensive crisis as the high, severe acute blood pressure, which is more or equal 180 for systolic and 120 for diastolic. This could be associated with end organ damage or not. So crisis means the blood pressure is severe hypertension. And it could be associated زي ما قلنا for the, with end organ damage. And the main organs that affected by the blood pressure is the brain, which can cause stroke or encephalopathy, or the eyes of the patient, which can cause a retinopathy, and heart associated with acute coronary syndrome, pulmonary edema, or aortic dissection, and in kidney can cause acute kidney injury. So if the patient had a hypertension, severe hypertension, it will affecting this organ. The cause could be primary or secondary, and there is some secondary hypertension associated with hypertensive crisis. This could be a pheochromocytoma, a tumor for the adrenal gland, and preeclampsia in pregnancy, and drug toxicity and medication non-adherence. It's important the patient who are using the antihypertensive to be adherent or يعني with a high adherence for the drug, use the drug at time زي ما عارفين, and don't miss some doses or stop the drug suddenly, which will give a reverse of blood pressure, which is opposite. It is controlled, become highly uncontrolled, and become severe hypertension. This is a common cause of the hypertensive crisis seen in hospitals. The drugs that can cause a hypertensive crisis are drugs that increase the blood pressure. Most commonly, the drug which is used in psychiatric, the MAO inhibitors, which is used as antidepressant and tricyclic antidepressant and steroidal antidepressant, and drugs which is used by addiction like the cocaine and amphetamine المنشطات وكده, and ecstasy, and stimulant that pills زي الفينترامين اللي كانوا بيستخدموه زمان لإنقاص الوزن. طيب, we have other terms. قلنا دي اسمها hypertensive crisis whenever 180, 120 or over. ده طبعا depend on ACC and AHA. فده بيعتبروا كده in other association or committee of cardiovascular of Europe or others. They regard more than that. في some association regard the systolic is 220 or over, like that. So we have some terms زي ما قلنا any patient with hypertensive crisis, the blood pressure is higher or equal 180, 120. If there is an organ damage, we call this as a hypertensive emergency, and we can detect the damage with the science and with the investigation, and this is known as a hypertensive emergency. Before, a historical name, they call hypertensive emergency as accelerating hypertension, and the management of this patient should be aggressive management, rapid control for the blood pressure, and the patient should use IV antihypertensive and should treat it in ICU with a close monitoring. This is if there is an organ damage, and this is a hypertensive emergency. If there is no end organ damage, just a mild symptoms, and till now the patient doesn't develop any end organ damage, so this is known as a hypertensive urgency. That mean we have to close monitor the patient, but no need for a rapid intervention with the patient or rapid decrease of blood pressure. This is a hypertension crisis without an organ damage. And here we use oral antihypertensive and we need to follow up and monitor the patient closely, and that is it. We have which is known as a malignant hypertension, with the historical also terminology. That means the patient has a severe hypertension with eye symptoms, which is a retinopathy associated commonly with papilledema. Type. We start how to manage the patient with a hypertensive crisis. If the patient has a hypertensive uh, crisis, so how to manage the patient here? طبعا this is the management approach. Firstly, we have to identify the patient has a hypertensive emergency or hypertensive urgency, and then the treatment depend on our decision. It will be admission and follow-up and oral antihypertensive if there is urgency only, and if the patient has emergency, we have to use IV drugs and to treat the patient in ICU and close monitoring for the patient vital signs. And the drug selection and dose depend on response of the patient and which type the patient has. And the prognosis is bad and poor if we don't control the hypertension, uh, even if there is no end organ damage, and within time the patient may develop end organ damage. طيب this is the treatment of hypertensive urgency. زي ما قلنا أهم حاجة there is no immediate intervention for asymptomatic patient. No need for immediate intervention or IV drugs or decrease the blood pressure rapidly, and the lowering of the blood pressure rapidly associated with a harmful effect for the patient. It can cause other harmful effect like brain edema and like that. So we have to control the patient. We have a type to control the patient. But if we have a patient with urgency, we have firstly to check for the end organ damage by investigation and symptoms are likely. We found the patient with a mild symptoms or no symptoms like headache and dizziness or like that. So if we confirm the patient has a hypertensive emergency urgency and there is a high blood pressure, by checking the blood pressure in both arms and check for the زي ما قلنا end organ damage, we have to move the patient to quiet room and recheck the patient after 30 minutes. Many of patients could respond to this, just monitor these procedures. So after 30 minutes, we recheck the blood pressure. We found the blood pressure start to decrease. If not, so we can use a rapid acting oral drugs. Here we just use an oral drugs, so we can use a drugs which can control the blood pressure or decrease the blood pressure quicker than the other drugs like clonidine, captopril, labtalol, and prozazine. This is the drugs which is used for control oral drugs, control the hypertensive areas. And then we check the patient, follow the patient. When the blood pressure starts to decrease, we have to reestablish the antihypertensive drugs which is used before, and to زي ما قلنا adjust the doses of the antihypertensive, and then we discharge the patient after the blood pressure decrease, and we recheck the patient or follow the patient after a week from discharge. If the patient has a hypertensive emergency, here we have to shift the patient to the ICU and give IV antihypertensive drugs immediately for the patient. We need to confirm there is end organ damage by the investigation. We need a close monitoring for the patient. We can do something known as intra-arterial blood pressure monitoring. We use a cannula inside the arteries to check the blood pressure in ICU, and also we use a basic metabolic panel. So we have to know about the BUN, about the electrolyte, the potassium, the chloride, the sodium, the calcium, and others, and the carbon dioxide every 6 hours. And we have to give the patient زي ما قلنا IV antihypertensive. We have to decrease the blood pressure لكن not very rapid because it can cause a hypoperfusion for some organ, especially like the brain. So we have to decrease the blood pressure in first hour and as initial therapy, not more than 25% of the blood pressure. So we look for a target مثلا for example إذا patient كان السيستوليك بتاعه 180 the 25% of 1 أو خلوها 200. So the 25% of 200 is about 40. So we don't decrease the blood pressure less than 160. We keep the blood pressure over 160 and for the systolic the same. So in first the hour and as initial treatment, not more than 25%. Within next 6 hours, we can decrease the blood pressure up to 160 over 100 or 110, and then we reduce the blood pressure to the baseline within 24 hours or 48 hours. We need an immediate intervention for the patient with IV, but we don't need to decrease the blood pressure very rapidly. We have to follow this way. But we have some patient in a special case, the decrease of the blood pressure in first hour could be less than the mentioned before. So if the patient has aortic dissection, for example, we have to decrease the blood pressure less than 120. Even if the patient may develop a hypoperfusion for some organs, like in still the aortic dissection with a high pressure is more serious than this hypoperfusion, so we have to decrease the blood pressure to 100 to less than 180 within the first hour. Also, if the patient is pregnant, has eclampsia or preeclampsia, or the patient has a pheochromocytoma, the systolic blood pressure could be decreased to 140 within 1 hour. Also, in patients with scleroderma and renal crisis, we have to use IV antihypertensive beside the ACE inhibitors or drugs because it is very important for protection of the kidney, and acute stroke depend on the patient status. We can use a different target. This is important and simple how we can manage the hypertensive crisis. You can follow it and you can treat the patient. Which drug of IV antihypertensive could be used in treatment of hypertensive emergency? Commonly, we use a calcium channel blockers, nicardipine and cilvidipine, and we can use also nitric oxide as a vasodilator. We can use a sodium nitroprusside or nitrates اللي هو nitroglycerin. Also, we use a direct a vasodilator like a hydrolase. The other drugs that could be used, beta blockers, beta and alpha blockers, and this is the drugs which is also could be used as IV drugs. And the ismolol, labetalol, phentolamine, phenolodipam, and enalaprilat. Here we have to mention and to يعني remember, all ACE inhibitors are oral except this drug, enalaprilat, is IV drug, so could be used in hypertensive emergency. The key consideration we have to know that the sodium nitroprusside should be used for a short duration with a limit dose because it associated with a cyanide toxicity with long-term use. And hydrolazine, very effective, decrease the blood pressure rapidly, commonly used during pregnancy and eclampsia and like that. And it has unpredictable response in some patients. So we can use a drug, and the drug يحصل له هو عنده very short half life و very rapid effect. The onset is rapid. In some patient it could be delayed, and it could be give a higher than expected effect. So we have to control the patient with a close monitoring to treat the patient if develop a severe hypotension. And beta blockers should not be used in patient with a caution or is a patient with a bradycardia, heart block, or acute pulmonary edema, because it will aggravate the case. The most commonly used drugs here is nitroprusside, labetalol, and nicardipine in emergency, the most commonly used drug. Here, this is a table for a specific condition, how we can manage every condition. You have just to outline and to know there is a specific drugs could be used for a specific disease. And that is all. Thank you very much, and see you later.